5 on your health tonight, caring for your child's cuts and scrapes during the summer.
Yeah, there are some important steps parents can take to lower the risk of infection, which is important. Here to talk about that, good to see you as always, Dr. Kristen Moffat, an infectious disease specialist at Boston Children's Hospital. You have 2 kids. You said we could say that. So you've treated your share of cuts and bruises over the years. Can you walk us through what you do?
Yes, plenty of cuts and bruises over the years. They're teenagers now, but lots of experience with that under our belts. I typically would start just by washing it pretty well with some soap and warm water. This is never comfortable for a child with a cut, so they're usually trying to get away from me while I would be doing that, but at least get it clean to the point where there's no longer any visible dirt or debris in the wound. And then usually I would do my best to cover it with a thin layer of like an antibiotic cream or an ointment, and then get either a Band-Aid or like a dry gauze with some tape over it. Wounds tend to heal best if they're actually kept a little bit moist, so applying that antibiotic cream or ointment and then covering it with a dry bandage really serves 2 purposes. It will keep it moist and help it heal, but it also will keep dirt from getting into the wound and from it maybe getting infected. So that would typically be what I do.
Okay, you know, it's the season. The kiddos are in the pool, they want to go in the ocean. Cuts and scrapes during that time, I mean, is it safe to do that? And how would that work with the Band-Aids and all of that?
Yeah, no, it's a great question. A small cut or scrape or something that's really almost completely scabbed over is probably okay. But in general, open wounds really should not be submerged underwater. And that's especially true if there's a chance that the water might have bacteria in it or might have chemicals in it that could be otherwise irritating to an open wound. So generally, it's best to cover an open wound with a waterproof bandage. So this may not look like a Band-Aid. It may be sort of clear plastic. You can find those in most pharmacies. And if you needed to swim and could cover it with a waterproof bandage, that would probably be okay. And then the swimming water should be as clean as possible. So a chlorinated pool would be better than a lake, a river, or an ocean until that wound is scabbed over.
You know, it sounds like common sense, but it is a good reminder for everybody. What are some signs that a parent should let you know what I'm trying to say? If there's a cut, it's going bad, when do you call the pediatrician?
Yeah. No, most cuts will start to heal in a couple of days. But some signs to call the pediatrician or get it checked out. If it's a cut that initially started to bleed a lot, but the bleeding stopped, but then it keeps reopening and bleeding again, that may mean that it needs to get checked out. It may need a couple of sutures or a little bit of glue to help it heal. And then otherwise, if the cut's starting to heal, a little bit of redness or itchiness around a healing cut is totally normal. But quickly spreading redness or any purulent drainage from a cut or any redness that's starting to sort of extend from that area that looks like streaking, that or any fever associated with a cut that's not otherwise well explained by something else going on, those are all signs that the cut could be infected and it should probably get checked out.
All right, good advice. Dr. Moffat, as always, it's great to see you. Thank you.
Thanks, doctor.
Good to see you too.